Hi, my name's Andrew Samuels. I'm a psychotherapist and I've been one for over 40 years. And I'm a former chair of the United Kingdom Council for Psychotherapy. And I want to say a few words about the therapy relationship. Everybody who has had therapy, and all therapists that I know, say that the therapy relationship is the most important part of the therapy experience. Because after all, you're going to talk to someone who starts off as a complete stranger about pretty intimate stuff and all kinds of problematic and delicate issues. I mean, you're going to talk about your strengths as well, and your therapist is going to be as interested in your strengths as in your problems. Nevertheless, when you get into that room, you're with a stranger and it's all very difficult. And gradually, the two of you build a relationship, and this is the most important part of the therapy. I think it's very important for clients, prospective clients, to know that they're going to have to work a bit at therapy. They're going to have to be active clients. It's not like being operated on or being given drugs or an injection or being given a structured program of homework or something like that. You have to play a pretty active part in the therapy relationship, and that means bringing all your emotions, your ideas, your spontaneous impressions, images that come to mind, anything, you have to bring that. The therapist is the other person in the therapy relationship, obviously, and I think many clients, especially at the beginning, don't realize how strongly involved, even passionately involved in their work with individual clients therapists become. Just as the client can't sit there and take the tablets but has to be active, so the therapist can't pretend that she's above the fray, completely cut off from all the emotions. And for example, what if a client tells the therapist about something that reminds the therapist of something in her own life? Or what if the client says something that's very difficult for the therapist to hear and to bear, some attitude, some social attitude the therapist doesn't like? It's an emotional business being a therapist. The therapist is in the therapy just as much as the client is in the therapy. What this means is that you need to be quite careful about how you choose your therapist. Some people say, well, just go ahead and follow your intuition and your instinct. And I have to say, that's not a bad way to choose a therapist. The two of you then get on with creating the therapy relationship just as well as you possibly can. But for many, perhaps even for most prospective clients, people thinking about therapy, there are a lot of things that they're going to think about in terms of choosing the therapist. And by the way, you should, wherever possible, insist on your right to choose a therapist. If you're simply assigned one and you're not comfortable, you need to speak up and say, please may I see an alternative therapist. And if you're looking for a private practice therapist where you're going to be paying a fee, do not feel shy to go around and see more than one therapist. I mean, don't see 20, but certainly see a few till you're feeling comfortable. The sex of the therapist is something people really do have concerns about. They know that making a relationship with a male or a female is going to be a very different experience. So that's something for people to think about. Personally, I'm not sure it matters that much, but if a prospective client has a strong feeling, then I would honor it, and I think people in the profession would honor it as well. Then there's age. I think there's a prejudice against seeing a young therapist, and it really is a prejudice. It's very silly to rule out a younger person as your therapist on principle, because younger people are enthusiastic, they're up to the minute in terms of their knowledge, and they will have had a very, very good training. So I really think that the conventional wisdom that you should see an older person is something to be challenged. If you have special concerns connected with ethnicity and sexuality, then it's very important that you explore these, because these are going to be part of a therapy relationship. We can't pretend it's just any old two people in the room when there's a therapy relationship. Everything to do with culture and with intimate life is important in the construction and creation of this relationship. So if you have issues to do with sexuality or ethnicity, raise them. Money and class is very important. If you have a therapist who strikes you as unlikely to understand where you're coming from in terms of class and money, then maybe that is a ground on which to pause and have a think about it. Because there's very little doubt that economic and social factors and experiences crop up in individual clients in the form of emotions and feelings. And I think that if you have a therapist that you think simply doesn't understand the world in which you live, the social world in which you live, then that's probably not the therapist for you. But in general, once you start, it's almost like a kind of chemistry. You don't quite know what's going to happen. The great psychoanalyst Carl Gustav Jung tells a story about his beloved alchemists, who he saw as kind of precursors, ancestors of contemporary therapy. They had a laboratory in which they did all their stinks and bangs and their alchemical early scientific type experiments. But they also had another room, which was a kind of thinking room, a reflection room, a contemplation room, where they would retreat to get themselves in good psychological shape to do their scientific and chemical work. And this room, well, it was called an oratorium, if you want to know, but this room was usually portrayed in etchings and paintings of alchemists as having a sign above the door. And I think this sign has a lot to tell us about the therapy relationship. In Latin, it was Dio considente, which in English means God willing. I wish you well in your therapy and in the therapy relationship that you will experience.